Welcome to the Egg Whisperer Show, a program exclusively designed to promote reproductive health awareness and discuss fertility preservation options. Here is your host, the Harvard-educated fertility specialist, Dr. Amy.
She's known as the Egg Whisperer.
Fertility expert Dr. Amy Vazadeh.
And you have yet another success story
Just launched by an East Bay fertility doctor.
Hi everyone, thank you for joining me on tonight's Egg Whisperer Show. The topic of tonight's show is how to get pregnant the Egg Whisperer way. This is not going to be pornographic. You're not going to see any pictures of people having sex. I'm not talking about different sexual positions, but this show has the potential to change your life forever. I'm going to teach you something that I learned probably around my mid-20s. The 3 questions that I'm going to go through with you right now, I mean, it seems weird, like I'm talking about how to get pregnant and why would I bring up these 3 questions? But you can apply these 3 questions to how to get pregnant the Egg Whisperer way and to your general life. So anytime you want to know something, you're just going to start with these 3 questions. I'm going to apply them to this how to get pregnant thing that I want you to master by the end of this show. So question number 1, what do I want? Okay, so again, you can do this to for anything that you're going through right now, whether it's, should I go to school or not? Do I want to be a doctor? Yes or no? So when it comes to getting pregnant, I want you to ask yourself this question and then say, I am 32 years old and I want to have a baby. Okay. And then I want you to be more specific about that. I want to do it naturally. I want to do it with IVF. So let's try this. So what do I want? Let's just be really basic. I want to get pregnant. Okay. So what is it going to take to get what I want? Well, I'm going to teach you those things. Well, it's going to take prenatal vitamins, having sex, having a really healthy lifestyle, and doing some preconception testing. And then the next question is, am I willing to do it? And so if the thing is that you're not willing to do the things that will get you what you want, well, then you have to change the number 1, which is, what do I want? And I have patients who come to see me, let's say, for example, they're 37 years old, and then I always ask people this question: what do you want when it comes to building your family? And at 37, if someone says, I want 3 kids, and then I ask them the question, what is it going to take to get what you want? And for some people, they know the answer to this question. They'll say, well, I'd like to get pregnant naturally for baby number 1, and then I'd like to adopt baby number 2 and baby number 3. So that sounds very reasonable. So are you willing to do that? Is that reasonable? Do your test results show that that's something that you can achieve? But if I have someone, let's say, that's coming in at 39 and they say, I want 3 kids, and then I'll ask them, well, what is it going to take, to get what you want? Well, I just want to try naturally and then have a baby every 2 years. Well, that's a problem because biologically speaking, that's not possible. So having a baby at 39 and then 2 years later having a baby at 41 and then 2 years later having a baby at 43, that sounds really awesome and amazing. But the reality is that statistically speaking, the chance that a woman can do that is less than 10%. For 90% of people will not be able to do that. And it's something that I want to teach people about because I imagine that, when I see 3-year-olds running around now, I look at them, I say, you're not going to have your first baby until you're 50. So if I can educate all you out there that are watching this, then maybe we can do everything possible to make sure that we continue to have healthy families in this world and in our society so that I have really, I was going to say something really funny, but I'm going to stop right there because we're talking about how to get pregnant, and then I'm going to break away to the Tushy method. And I know for those of you who watch this show and watch me talk about the Tushy method over and over and over again, clearly I never get sick of it. Because until everybody knows that there are 5 simple tests that you can do to check your fertility, everybody, I mean like primary care doctors, fertility doctors, OBGYNs, and certainly fertility doctors know this stuff, your friends, family members, your neighbors, the person checking you out at the grocery store, I want you to go up to them and be like, do you know what the Tushy method is? And if they say no, teach them. So T is for tubes, U is for uterus, S is for sperm, H is for hormones, and Y is for your genetic profile. Do you have to do all these tests as part of the Egg Whisperer way of how to get pregnant? The answer is no. But at some point, if you're struggling to conceive, the answer is yes. And should you maybe do this at the very beginning and maybe do a few things like your genetic screen, maybe a sperm test, and get your levels checked? I would say, yeah, I do think that that sounds like a really proactive way of starting your family, knowing more things than less, so that you feel really empowered that you're doing the right things for you to have the family size that you want. So here are the basics. I mean, I kind of already talked about them. How to get pregnant the egg whisperer way is to start off by taking prenatal vitamins. Learn about ovulation. Know when you're ovulating. If you're having irregular cycles, find out why. Make sure it's not from a thyroid problem. If you have PCOS, make sure to balance the hormones that are imbalanced. For example, if your TSH is high, your prolactin is high, your vitamin D is low, your testosterone is high, your hemoglobin A1C is high. See, these are a lot of things that I check for my patients with PCOS. So finding out that, ovulation is something that should happen approximately every month. And if you're not having periods over a 6-month period of time, it's really hard to get pregnant. And I've seen this where people are being told, oh, you need to wait a year, but the patient's not even ovulating. I mean, that's really unfair. So if you're one of these people that aren't ovulating regularly, figure out why and see what you can do differently to help yourself ovulate. So for example, checking thyroid, if it's abnormal, that's easy to treat. If your prolactin's high, well, that's pretty easy to treat. If you have PCOS and maybe your testosterone's high, sometimes just treating it and bringing it down with different medications can also help, and it doesn't have to be pharmaceutical drugs either. You can take, I call them nutraceuticals, but things like, for example, ovasitol, N-acetylcysteine, lipoic acid, all these things in combination with CoQ10 can sometimes help some people with having normal, regular periods. Also with lifestyle changes, weight loss, and along with lifestyle changes would be dietary changes too. So finding out when you ovulate can be rather simple for some people, but sometimes a little bit harder for others. And what I mean by that is if you're having a regular 28-day cycle, you're usually ovulating around day 14. The first half of your cycle tends to fluctuate just a little bit, but the second half from when you ovulate to when your period starts tends to be pretty constant and stable. So you can use an ovulation predictor kit. Another term for that is OPK. These are strips that you can dip your pee in, and then you can see one solid line and then one other line that it's absent, and then it gets lighter, and then as it gets darker and darker, you're getting closer to ovulation. And when it comes to the next thing that you need to do to have to get pregnant, the egg whisperer way, is to obviously have sex. And no, sex is not dangerous. IVF babies are not. People sometimes say to me, Dr. Amy, I want to do IVF because I want to make sure that I have a really smart baby that doesn't have any genetic issues, and having sex is dangerous. And for now, having sex is still not dangerous. Making a baby in bed is still not dangerous, and I highly recommend it because it is cheaper than other methods of getting pregnant. However, I do recommend seeing a fertility doctor, an OBGYN, your primary care doctor, about getting preconception tests first, so that you know that you're going into a pregnancy with the healthiest lifestyle. So if you haven't had your blood pressure checked, what if you have high blood pressure? What if you are pre-diabetic, and maybe those things should be evaluated and treated first? That's really important, because if you go into a pregnancy, for example, with a BMI over 30, high blood pressure, pre-diabetes, well, those things can increase your risk of having preterm labor, preterm delivery, preeclampsia, and subsequently other, not just pregnancy complications, but also issues in your children. And if someone told you these things before you got pregnant, certainly you might have an opportunity to change your change some of the things that you do, and have an opportunity to take medication, see specialists, and get into the best shape ever so that your pregnancy is as healthy as possible as well. So here are some of the things that I've talked about on this show for the past couple of years. And the fertility diet is something that I want patients to know about. This is also how to get pregnant the egg whisperer way. So this is for people who are doing IVF. So the D stands for diagnosis. So make sure you know what the diagnosis is, so that you're in the best place ever when you're ready to do your IVF cycle. So you never look back and say, gosh, why didn't I do an extra test on the sperm like a DNA fragmentation test? Why didn't I take supplements like CoQ10, or my husband take antioxidants? And then when it comes to the E, after the IVF cycle, that's endometrial testing. For me, every embryo that I help my patients create is really precious and important. I call every pregnancy a very important pregnancy in my practice. And so I want to make sure that I talk to my patients about testing that they can do on the endometrium before they do the transfer, which is the T. So if you don't know what that fertility diet is, please find out more. You can find out more on my website, find out more on my Medium channel. I have blog articles there and on my previous YouTube shows where I've talked about the fertility diet. But certainly this is for anyone, no matter where you are, especially if you're doing IVF. The other thing that I talk about is a fertility team. So, when you're getting pregnant and you're really frustrated and you might be having some relationship issues, it's important to talk to a therapist. Sometimes, when things are very emotional, you have a hard time eating the healthiest foods. So talking to someone about how to eat in the most healthful way possible can be helpful. And then working on exercise, and if you need a personal trainer to help you, that's something that I think can be really important and helpful too. And then the A part of the fertility team is acupuncture. Acupuncture can help reduce stress in patients. It can help my patients feel like they just have another support person that's rooting and cheering them on. And my patients share with me, not everyone enjoys it, but a lot of patients really feel much more relaxed coming out of their treatments. And so if that's something that you want to experience, you can always do a consult with your local acupuncturist and then decide if continuing treatment is something that you want to do. I certainly work as much as I can collaboratively with the acupuncturists I work with, but some things that I see that some people start taking, like certain Chinese herbs, I'll always give my input to make sure that my patients are taking things that I think are going to be always helpful and not harmful. And then the last thing as part of this fertility team is mindfulness and meditation. There are so many apps that people can use now, like calm.com, CALM. So if you haven't learned how to do deep breathing exercises, and this is one thing that I do with my patients. So for example, when I'm doing a procedure, I always make sure my patients know where their happy place is, know what it looks like, know what it smells like, know what it sounds like as you're walking through it, so that whenever you're feeling a little bit of stress as you're going through fertility or even trying to get pregnant, that maybe the experience isn't going to be as stressful. So you've heard me talk about these things like the Tushy method, the fertility diet, and the fertility team. So I'm hoping that these things can help you in all things in your life. Everyone needs a team, no matter what they're doing, no matter what they're going through. You can take out the word fertility and put in whatever else you're going through, and certainly the elements of that team can help you. So as far as how to get pregnant the egg whisperer way, aside from the obvious things that we've, not so obvious, I wouldn't do the show if it was super obvious. I want people to learn from me. But these are the things that I think that if everyone knew these things, then perhaps there would be less heartache and heartbreak down the road for people as they're trying to build their families. So these are what I call the egg whisperer golden rules. And I have discussed these on this show before, but I thought this would be a great time and place to do it as I'm talking about how to get pregnant. So it's important to get your levels checked, in my opinion, if you're around the age of 21. That's when we recommend that people should be getting their first pap smear, especially if, for example, your mom had fertility issues, your mom had early menopause, your sisters went through the same thing, early menopause, or had fertility issues. If you have a personal or even family history of endometriosis, or what if you had an ovary removed? So, if you've had one ovary removed, that means half of your eggs are now gone. And so you want to make sure that if the other ovary if you're going through a situation where you may want to know sooner than later that you might have a low egg count, certainly there's no better time than the age of 21. And then for other people that don't necessarily have that personal or family history, I think it is reasonable to start checking at the age of 25 and then every few years, and then start talking about, if you aren't partnered or are ready to start a family one way or another at the age of 32, and it doesn't have to be 32, it can certainly be like 32, 33, 34, as you're getting your levels checked, you'll see when is a good time for you to actually get your eggs frozen, especially if you want more than one baby. And then if you haven't started a family yet or haven't frozen your eggs by the age of 37, and you're maybe even considering being a single mom, then I would suggest freezing embryos. And if you know me, you know that the word single mom sounds silly to me because no one's really single, especially when you're a mom, because you have a baby in your life. And I just think of you as being, for example, a mom by destiny. So we constantly hear about people advocating egg freezing, but we don't hear enough about embryo freezing, especially for people who are partnered or want to be a single mom by choice or single parent by choice by the age of, if they're 37 or older. So it's so hard to educate people because I feel like a lot of these fertility myths are ingrained in us. I hear sometimes patients tell me that other doctors tell them these things. I'll share some of them with you. For example, I had some patients say, "Oh, my doctor told me if I got pregnant, at 41, then my next pregnancy will be much easier for me to achieve." And that's just not true. The chance of pregnancy as we get older doesn't get better; it gets lower just because of the age of our eggs. And I'm not trying to be, negative. I'm obviously a super positive person in the way that I talk and the way I try and educate people. But the same way, I don't want anyone to ever be misled and think that that's true. And the other thing patients will say to me, "Well, my mom had a kid at 40, so I should probably be able to also." But your fertility isn't necessarily your mom's fertility. So getting your levels checked and really understanding what they mean for you and looking at your ovaries and your intrafollicle count, I think those are going to be really helpful tools for people to do. And hopefully they're going to be done more and more commonly, not just by fertility doctors like me, because there just aren't enough of us, but just by OBGYNs as well, who are able to do ultrasounds in their office. I think that would be a helpful tool for them to help us with. And then the other thing is that, you see so many women on birth control pills and have IUDs placed. They just don't necessarily understand that when you're getting regular cycles on the birth control pill, it doesn't mean that you're actually ovulating regularly and having regular cycles. These are just induced with hormones, and you wouldn't necessarily know if you're running out of eggs or going through early menopause unless you stopped the pill. I see patients who, let's say, started the pill at 17 and stopped at 32 when they were ready to have kids, and then find out that they were out of eggs. So I strongly recommend that people, before you start birth control pills, get your AMH level checked. And then once a year, get it checked, knowing that birth control pills can suppress the AMH by even as much as 20%. And the same thing for having an IUD placed, especially if it's a hormone-secreting IUD. These IUDs can cause you to have irregular periods or just a complete absence of periods. And if that happens, it's really hard to know what's going on with your fertility because you're not relying on the normal signs and symptoms of, let's say, ovulation to tell you if something might be amiss. So again, get your AMH checked before you get your IUD placed, and then maybe once a year, and especially when you're ready to have it removed and have another one replaced, see what your levels are, and then just talk to yourself the way that I seem to. Ask yourself the questions, what do I want? How old am I? What is it going to take to get what I want? And am I willing to do it? And I find that these 3 questions are really helpful, especially for people in tough relationships. And what I mean by that is, I have patients who come to me, for example, at 39, and they really want kids and their partner doesn't. And so it's a tough situation to be in because the female partner, for example, still has healthy eggs, but the male partner isn't ready to have kids, and he can certainly go on and have kids 10, 20 years later. But my patient has to make this tough decision of what is it going to take to get what I want, and it might have to mean changing her relationship status and maybe doing this on her own or finding a new partner. And then she has to ask herself, is she willing to do that? So that's why these 3 questions are really important. If the answer is no, you're not willing to change your relationship status, or then you have to change what you want. And you have to be really honest with yourself and see a therapist, because I think that's really important. So I go through these 3 questions, for example, with my egg freezing patients, no matter what the relationship status is. And I also have my patients see a fertility-minded therapist who goes through a fertility preservation psychological evaluation. It's not necessarily an evaluation, it's more an education appointment. There's no evaluations at all. So I hope you're learning a ton from this show tonight, because I certainly love talking about this stuff. And then the other Egg Whisperer golden rule is, before you even start birth control pills, to consider a carrier screen. The carrier screens that we do nowadays have over 100 genes in them. And one of the genes, actually there's 3 of them in there, that tell us if a patient has an increased risk of forming blood clots from birth control pills. So, you hear of young women who have a stroke or a blood clot from a birth control pill. Well, a lot of times if you did the testing up front, you would learn that they had something like factor V Leiden or a prothrombin gene mutation, or both, and that can put them at a higher risk. So I hope these golden rules really help you. I've done egg freezing parties since 2014, and now I feel like I need to start talking about egg thawing parties, because so many women are freezing their eggs, and I feel like people aren't learning the proper steps that it takes once you're ready to thaw your eggs. So if you haven't seen my egg thawing party article on all the steps that you need to go through when you're ready to thaw your eggs, you can imagine that I'm also going to be talking about the tushy in that article too. But it's super important to spend as much time on sperm health as you do on egg health, to realize that sperm age matters too, and to take CoQ10 until you're done having babies, because it can certainly potentially help with the mitochondria in your cells. But if you're an egg freezing patient of mine, I ask you to take CoQ10. If you're, let's say, 25 years old, I'll tell you to start taking it as soon as you decide to freeze your eggs up until the time you're done having your kids. So thank you guys. I know that was a lot of information, but I basically just taught you how to get pregnant the Egg Whisperer way. And it doesn't involve IVF, it doesn't involve egg freezing. It can simply involve taking prenatal vitamins, having a healthy lifestyle, having sex, and getting your tushy checked. So thank you guys. I hope you enjoyed tonight's show. And if you ever have any questions, you can always find me online on all my different social media handles, and also in my office. You can go to my website, sorry about that, dramy.org, draimee.org. Have a great night. Thanks, you guys.
Welcome to the Egg Whisperer Show, a program exclusively designed to promote reproductive health awareness and discuss fertility preservation options. Here is your host, the Harvard-educated fertility specialist, Dr. Amy.
She's known as the Egg Whisperer.
Fertility expert Dr. Amy Abazadeh.
And you have yet another success story.
Just launched by an East Bay fertility doctor.